Senator Welch.
Thank you very much. You know, we're talking about the demographic challenges, and it's interesting. I just want to start with you, Dr. Edwards, about the factors that you attribute the reduction in fertility, and it sounds like it's voluntary.
Decline in fertility is unmet fertility intentions of people not having the kids they want. For millennials, including elder millennials like myself, part of it was a delay. That the fertility that we are currently seeing as a decline can still be regained because fertility is falling for women under 30 but rising for women over 30, which is why something like infertility coverage as part of health insurance would be helpful in this kind of notion to drive up fertility. But the reason why, in surveys, parents say it's expensive. Every part of having a kid is expensive. Childcare is expensive. They don't have paid leave. It costs $2,600 to deliver a kid out of pocket if you have a vaginal delivery. If you have a C-section, it could be $32,000. There's a lot of money for that's taxing a kid being brought into the world. That's the opposite of what you want to do if you want children.
So in France, where they have a stable fertility rate and above replacement rate, they have paid family leave. You don't pay for your health care, so you don't have that expense. You have child care.
It's not that everything is free there, but they do have support around young children. That's certain hallmarks of we lack in the United States. But there is also a room for just kind of basic economic malaise to hit people's childbearing intentions. That you don't own a home, you're not married yet, you don't earn as much as you want.
But policy issues there. A lot of folks here have been very strong proponents of having public policies that are pro-family. And I think the way a lot of us define pro-family is you can afford child care, you can afford health care, you can have confidence that if somebody's sick, a child, a partner, you'll be able to take some time off. And I guess the obvious question is, in your view and in the basis of your studies, would those types of policies likely influence the fertility rate?
Yes, because you can't make people have children, but you can make it easy.
That's a big deal. If we had more legal pathways and could have more immigrants coming in.
Yes, so one of the benefits of legal immigration is we can tailor the system to exactly the needs of our workforce. We have that benefit being the United States of America. I've heard economists refer to immigration as the economic superfood, which I think is an appropriate adjective for what we could do with immigration, economic growth.
All right, and then, the other thing that Senator Klobuchar was talking about were some of these costs. It's unbelievable how much health care costs in this country, and it doesn't matter whether you're on Medicaid, Medicare, private employer-sponsored health care, or you're paying yourself. We pay the most and get the least. It's the same is true for cable and internet. there's a lot of expenses in this country that everyday families have to bear that are brutally expensive. So I'll ask maybe Dr. Scott and then Dr. Topoleski, how much, where we have policies that try to essentially promote, I hate to say it, competition that would result in lowering cost for families, would that have an impact potentially on people's sense of confidence that they can have that other child that they would love to have in their life?
No, here we go. I would hesitate to give an answer just because we haven't really studied about which I think is a really interesting issue, how the costs of some of these services and goods might affect fertility decisions, but certainly, we could certainly see that happening, those scenarios where, lowering certain costs could have an effect on decisions, but that's something that's a little bit beyond my expertise, I think.
And my answer